So, can you talk a little bit more about how systemic racism specifically, and there's some questions about other types of inequities too that we can address,
Mhm.
but specifically how systemic racism plays into these health inequities?
Yes, and Sarah, this is such an important question because I think a lot of times, because of the trigger, a lot of times that the word racism plays into things, it's hard for people to want to fathom that that plays a integral role tied to health inequities, but it does. And I think a lot of that is we have to think about the interconnectivity tied to that. And systemic racism impacts all institutions and industries within and across the American society. It's not just healthcare. And
Mhm.
it's the fact that our country was really founded and based on a philosophy of white supremacy. And we have to acknowledge that. And unfortunately, much of our experiences today deal with the very existence of that foundation. And because of that, a lot of a result is a lot of the policies, laws, regulations, resource allocations, and power with our country is still based on that supremacy model, despite the fact that we have broad racial, ethnic, and cultural diversity within our demographics. However, racism impacts us at multiple levels: the individual level, interpersonal, institutional, and systemic level. And because health and healthcare are not immune to racism's grip, it's related to a lot of the disparities that we see across different populations. When you see that, that impacts cultural competency and how we're even thinking about what we need to be expecting of our organizations as it ties to understanding how do we even identify these health inequities? How are we making sure that we're not only collecting this data, but that we're looking at that and monitoring it to determine what our strategies are? There's got to be a component that we're also educating internally about understanding the interconnectivity between systemic racism and health inequity so that there's an understanding and awareness of why we have to move forward. And I think a lot of times we want to skip that step, skip the education and awareness piece and just get to solutions. But we've got to get that underlying, educational foundational piece to really start to see true change.
What I love about your response to that question, twofold, and both of these things are things that are levers that right now can be pulled that, I want to make sure to underscore so that our attendees on this call know what they can do. The first one is if they're sitting there thinking education is not enough, they can put that to bed. That can be a place to start, and that's valuable, and that can be foundational to your initiative. If you do nothing else in H1 or the first year, is building the awareness and raising the conversation, to your point, at all levels of the organization, not just at the leadership level. The other thing that I heard, and it made me think about the birth of the wellness industry, our founder who started WELCOA in the mid 80s was deeply concerned about a systemic issue of declining health and said, okay, maybe we can't handle it at the population, at the public health perspective, or maybe that's not his role or what he was interested in, but he was thinking, okay, people spend 90,000 hours of their lives at work. Maybe we can start handling the systemic issue within the microcosm that is the employer. If these things don't exist in the broader community's resources, we can at least guarantee that when they get to work, they're going to have them. And I think this is a parallel equity, right? Even if we as, on this call, HR professionals, well-being professionals, consultants to health plans and what have you, this feels like a big, hairy, audacious goal, dealing with these inequities and the impact that they have. But the workplace can be a great equalizer if we start making these changes that you're talking about. And I think that's really important.
And I think to your point, Sarah, you have to recognize that your employees are bringing lived experiences into the workplace. So with those lived experiences, they are also bringing whatever they might be dealing with at home, what they're having to deal with from a national scale. and then trying to figure out how do I move forward in a workplace where there might be microaggressions that I'm moving through. There might be still systemic policies that impact, even from a gender perspective, how I'm able to advance in the organization, or how I'm able to show up as both maybe a parent and an employee here. And thinking about the implications about how are you setting policies or processes that invite people to really show up as their whole self and don't have to feel as though there's retaliation or punishment for stepping into that space of truly being whole.
The other piece that I'm hearing in that is, again, before you start adding things, is there something that needs to be fixed? Right? That could be also phase 0. Is like, what's broken before you think about what things to add on to make to improve equity. What are the detractors that we could address? And it starts with naming them, identifying them, and educating. I have a specific question from someone. I'm not going to say who they are. It's anonymous. And they say, we have the data, we have, carrier wellness programs. And it shows that the Latinx community of employees are at higher risk for complications from obesity and diabetes. And the simple question is not a simple question at all. The straightforward question that is a very complex answer, I'm sure, is, where do we go from here? This is the hardest part. When you identify it, now what?
I think one of the things I would recommend is we identify it, but then we try to solve it without having people in that patient population at the table, right? So there has to be a way for us to think about how do we understand the perspective for the patient population that's impacted, to understand what are ways to find solutions. I think a lot of times we want to take the data, we want to identify what are some strategies, what are some solutions, and let's pressure test a couple of things. How are you engaging that community, both at the patient or employee level, to understand what are some things that I may not understand if I do not identify as Latinx? And then how do I now have that front row seat of your perspective and your understanding and awareness of where those opportunities are, and then blend that into some of the solutions or strategies that we're thinking about in our organization. So inviting members of the community to be able to share and give some of that feedback because they are of that patient population or of that population adds to what you can think about to actually move forward. We're still trying to solve in a vacuum.
So is it a just ask kind of, how are employers doing this without putting too much burden on the underserved population to provide answers?
So some of the things that we've seen from employers is leveraging their employee population, right? To understand what are some things that they're recognizing, especially if the people identify in a similar fashion with that population. And then understanding where are the, not decision makers, but almost the areas of influence within that population, and inviting them to the table. And that looks like very different things. That could be focus groups, that could be actual outreach, that could be surveying, but a lot of that is a just ask and starting, and then understanding how do we start to get more information in a way that it's going to be well received for your population.
And, I do want to highlight too, and I don't know if you have any thoughts or wisdom on that you want to immediately share on this, but recognizing this is going to be hard work, right? Like figuring it out, getting the answers, and then, this person feels like they have the data and that's hard, but what if they have the data and the answers, that's probably also going to lend itself to some hard work. But I'm assuming that you have success stories from just health that you could share that's like, no, people do this. There is a path for getting this done, right?
Yeah, I would share success themes, right? Because I think each organization is a little bit different in the journey that they've taken. And some of the success themes is that you have to recognize, first of all, that there is not a true destination, it's a journey, right? And so there have to be some mile markers along that journey to identify what are we able to accomplish in this time frame? What are we identifying as transformative and the iterative steps that get us there, right? This is not something that we solve for and then we say, okay, check, let's go to the next, thing, right? We wash our hands of it, but you've got to identify that it's a journey. And then part of it is recognizing that instead of this being an additional thing that we're already asking of our team members to do, how is this really the foundation of everything that we do? Getting back to understanding, how does this align with the mission and vision of the organization? What are key components? Again, a lot of it starts with that internal education, right? So now from every lens, from every business unit, from every department, it's a part of everything that we do, from our HR policies, from how we even think about the data that we're collecting, from even some of the relationships that we're having with our vendors. Those are the mile markers that you have in the journey to start to see the transformational change in the work.
I love that. I think that is so empowering for folks to hear who are sitting at the beginning of this, or maybe, had a setback or it's not going as quickly as they would like to see in terms of outcomes.
Mm-hmm.
Just going back to one specific tactical example with that question about the Latinx community, or any community where you're seeing increased rates of, diabetes or obesity. Let's pretend for a second that people on this call may or may not know exactly where some of those outcomes come from in terms of the inequities. Can you just give some examples of what is pushing on underserved communities that may be resulting in what they're seeing this in their data? They're seeing obesity, they're seeing diabetes,
mm-hmm.
but I'm assuming that we all have some general idea, but just to make it super salient.
So I think it goes back to what I was talking a little bit more about, just a definition from the Robert Wood Johnson Foundation. You have to think about some of those other components in that person's entire life that impact some of those health outcomes. And it could even be access to adequate food sources, right? Or the ability to pay for the food that might even help with addressing some of those outcomes around obesity and some of the underlying causes that come with that. But when we don't start to look at things around poverty or housing conditions or transportation or some of those access components, all of that is tied to that, right? Like, we have to think about even health literacy for certain patient populations. What access do they have to that? Trust as it relates to, just their experiences in the healthcare community. All of those components are tied into where you're starting to see a lot of those disparities. And when you're looking at the data, you have to think about, what are some of those underlying causes that we're not paying attention to that also need to be addressed and considered?
I really appreciate that, because I think oftentimes, and there's anonymous question about this as well, oftentimes in the wellness industry, we think a lot about what we're trying to do to get people to change their behaviors if those behaviors are risky, right? Eat more fruits and vegetables, walk more, increase compliance with preventive screenings, those sorts of things. I know that that's a component of this, but can you speak a little bit to the balance between asking people to change behaviors and reducing barriers to change behaviors? How much of it, in your experience, is it really about choice, versus things that are pressing, that are systemic, that are impacting their ability to choose?
I think a lot of it's systemic, Sarah. I think a lot of it's systemic, right? There's a lot of times where we're trying to plug the individual hole, right? But there are systemic things that still impact the institutions of healthcare. There are still policies and processes that still have the undertone that create barriers and power dynamics that impact these underserved communities. And so when you're thinking about an individual change, or thinking about, how do I make this change for this patient? It may be a solve for that moment, but the systemic change is what's needed. That institutional level is where you have to see the true impact.
I appreciate you making that really salient. We've said a lot at WELCOA, we see trends, even as a whole total population level, not even drilling down into inequities amongst different populations, declining health. And it does not make sense that we all got together one day and all just started making terrible decisions. Mm-hmm. That's not what's changed.
Mm-hmm.
What's changed is the environments within which we're making the choices.
Correct.
And I think that shift in thinking about it's less about motivating people to change and more about removing the barrier. To your point, we're not going to be as impactful in any of our health and wellness goals for our employees if we don't understand what's pushing on them.
Mm-hmm.
And I just wanted to, I appreciate you answering that question. I really wanted to make sure that we made that salient. Okay, so you alluded to the process, of course, and how it's iterative and it evolves. A lot of our members work with vendors and their health plan as partners on this. Can you talk a little bit about metrics or processes that if they do have a partner that they should be asking about, asking for, and how to really maximize that partnership so that they don't feel like they're a lone wolf doing this?
Sarah, we get this question often, and we really break it into 4 main components or questions that employers should be asking vendors related to health equity. And these questions can lead to the metrics that you just mentioned that can be used to evaluate performance with those vendors. And I'll just highlight those 4 different questions. The first is, how does your program, plan, or service actually address health equity? Get very detailed there. And do you have tangible results that your efforts are making a difference, right? So it's not enough to say, yes, we have these different initiatives and strategies, but what are the tangible results that I know that there's efforts making a difference? That's the first question. The second would be, do you collect data on employee populations, what we call real and SOGI, or social needs? So real is race, ethnicity, language, and then SOGI is sexual orientation and gender identity. But then in addition to that, are they also collecting data on social needs? And if so, how is that data and information being used to improve performance? Another question that we ask is, or that we encourage employers to ask vendors is, what are you doing to assess and improve healthcare disparities? Like, how have you actually quantified the financial impact of these disparities? And then the final piece is, how are you ensuring that your plan or your service and the communications tied to it are culturally appropriate, understood, and effective? So that's just to kind of start, Sarah, on some of the 4 high-level questions that we're typically encouraging employers to ask.